Types of therapy. What is psychotherapy? Psychotherapy, also called talk therapy, is a type of mental health treatment. It's often used either alone or with medications to treat mental disorders. During a psychotherapy session, you talk to a doctor or mental health care professional to identify and change troubling thoughts. Benefits of psychotherapy. Psychotherapy helps people with a mental disorder to understand the behaviors, emotions, and ideas that contribute to their illness and learn how to modify them. Understand and identify the life problems or events, like a major illness, a death in the family, a loss of a job, or a divorce, that contribute to the illness, and help them understand aspects of those problems they may be able to solve or improve. Regain a sense of control and pleasure in life. Learn healthy coping techniques and problem-solving skills. Types of psychotherapy. There are several approaches that mental health professionals can take to provide therapy. After talking with you about your disorder, your therapist will decide which approach to use. Cognitive behavioral therapy. Cognitive behavioral therapy focuses on exploring relationships among a person's thoughts, feelings, and behaviors. During CBT, a therapist will actively work with a person to uncover unhealthy patterns of thought and how they might be causing self-destructive behaviors and beliefs. The core principles of CBT are identifying negative or false beliefs and testing or restructuring them. Oftentimes, someone being treated with CBT will have homework in between sessions where they practice replacing negative thoughts with more realistic thoughts based on prior experiences or record their negative thoughts in a journal. Interpersonal therapy. Interpersonal therapy focuses on the behaviors and interactions you have with family and friends. The goal of this therapy is to improve your communication skills and increase self-esteem during a short period of time. It usually lasts 3 to 4 months and works well for depression caused by mourning, relationship conflicts, major life events, and social isolation. Psychodynamic and interpersonal therapies help you resolve mental illness caused by loss or grief, relationship conflicts, role transitions such as becoming a parent or a caregiver. Dialectical behavior therapy. Dialectical behavior therapy is a type of cognitive behavioral therapy used for high-risk, tough-to-treat patients. The term dialectical comes from the idea that bringing together two opposites in therapy, acceptance and change, brings better results than either one alone. DBT helps you change unhealthy behaviors such as lying and self-injury through keeping daily journals, individual and group therapy, and phone coaching. DBT was initially designed to treat people with suicidal behavior and borderline personality disorder, but it has been adapted for other mental health problems that threaten a person's safety, relationships, work, and emotional well-being. Supportive therapy. Your therapist coaches you on how to learn to manage your anxiety and unhelpful thoughts on your own. This approach helps bolster your self-esteem. Alternative and complementary forms of therapy also may help. You can use them in combination with regular psychotherapy. Animal-assisted therapy. Dogs, horses, and other animals may help ease anxiety, depression, and bring comfort. Art and music therapy. This can allow you to express and process your grief and other feelings. Mindfulness-based stress reduction therapy is a meditation therapy. Though originally designed for stress management, it is being used for treating a variety of illnesses such as depression, anxiety, chronic pain, cancer, diabetes mellitus, hypertension, skin, and immune disorders. Eye movement desensitization and reprocessing therapy. EMDR is used to treat PTSD. A number of studies have shown it can reduce the emotional distress resulting from traumatic memories. EMDR replaces negative emotional reactions to difficult memories with less charged or positive reactions or beliefs. Performing a series of back and forth, repetitive eye movements for 20 to 30 seconds can help individuals change these emotional reactions. Exposure therapy. Exposure therapy is a type of cognitive behavioral therapy that is most frequently used to treat obsessive compulsive disorder, post-traumatic stress disorder, and phobias. During treatment, a person works with the therapist to identify the triggers of their anxiety and learn techniques to avoid performing rituals or becoming anxious when they are exposed to them. The person then confronts whatever triggers them in a controlled environment where they can safely practice implementing these strategies. There are two methods of exposure therapy. One presents a large amount of the triggering stimulus all at once, flooding, and the other presents small amounts first and escalates over time, desensitization. Both help the person learn how to cope with what triggers their anxiety so that they can apply it to their everyday life. Psychodynamic psychotherapy. The goal of psychodynamic therapy is to recognize negative patterns of behavior and feeling that are rooted in past experience and resolve them. This type of therapy often uses open-ended questions and free association so that people have the opportunity to discuss whatever is on their minds. The therapist then works with the person to sift through these thoughts and identify unconscious patterns of negative behavior or feelings and how they have been caused or influenced by past experiences and unresolved feelings. By bringing these associations to the person's attention, they can learn to overcome the unhelpful behaviors and feelings which they caused. Psychodynamic therapy is often used for treating depression, anxiety disorders, borderline personality disorder, and other mental illnesses. Tips for effective psychotherapy. Effective therapy depends on your active participation. It requires time, effort, and regularity. Keep these tips in mind as you start your therapy. Attend all of your scheduled appointments. Work with your therapist to set goals at the start. Review them from time to time. Identify sources of stress. Try keeping a journal and note stressful as well as positive events. Reset priorities. Emphasize positive, effective behavior. Communicate. Explain and assert your needs to someone you trust. Write in a journal to express your feelings. Focus on positive outcomes and finding methods for reducing and managing stress. Be open and honest. Success depends on your willingness to share your thoughts, feelings, and experiences and to consider new insights, ideas, and ways of doing things. If you're reluctant to talk about certain issues because of painful emotions, embarrassment, or fears about your therapist's reaction, let your therapist know. Stick to your treatment plan. If you feel down or lack motivation, it may be tempting to skip psychotherapy sessions. Doing so can disrupt your progress. Try to attend all sessions and to give some thought to what you want to discuss. Don't expect instant results. Working on emotional issues can be painful and may require hard work. You may need several sessions before you begin to see improvement. Do your homework between sessions. If your therapist asks you to document your thoughts in a journal or do other activities outside of your therapy sessions, follow through. These homework assignments can help you apply what you've learned in the therapy sessions to your life.